Leukemia is cancer of the white blood cells. White blood cells help your body fight infection. Your blood cells form in your bone marrow. In leukemia, however, the bone marrow produces abnormal white blood cells. These cells crowd out the healthy blood cells, making it hard for blood to do its work. In acute lymphocytic leukemia, ALL, also called acute lymphoblastic leukemia, there are too many of specific types of white blood cells called lymphocytes or lymphoblasts. ALL is the most common type of cancer in children. Possible risk factors for ALL include being male, being white, previous chemotherapy treatment, exposure to radiation, and for adults, being older than 70. Symptoms of ALL include weakness or feeling tired, fever, easy bruising or bleeding, bleeding under the skin, shortness of breath, weight loss or loss of appetite, pain in the bones or stomach, pain or a feeling of fullness below the ribs, painless lumps in the neck, underarm, stomach, or groin. Tests that examine the blood and bone marrow diagnose ALL. Treatments include chemotherapy, radiation therapy, stem cell transplants, and targeted therapy. Targeted therapy uses substances that attack cancer cells without harming normal cells. Once the leukemia is in remission, you need additional treatment to make sure that it does not come back.
Every year, hundreds of children are diagnosed with the most common childhood cancer. It's called acute lymphoblastic leukemia, or ALL.
Okay, take a deep breath.
Leukemia is a disease that begins in the bone marrow. And though ALL is just one of many different kinds of leukemia, it is the most frequent and curable type in children. Children with ALL will spend approximately 3 years of their lives being intensely monitored and treated with chemotherapy to fight this disease. We would like to introduce you to ALL and to the team involved in treatment, and to parents who have witnessed their children's courage in conquering this disease.
My son Jeremy was 11 when his symptoms began. At first they were subtle. He just wasn't like himself anymore. He started not being interested in hanging around with his friends. He was napping a lot, seemed tired all the time, but when he'd sleep, he didn't seem refreshed when he woke up. He started complaining that he had pain in his limbs. His appetite was down, he was losing weight. He was just not well, but we didn't know what was wrong with him. Early medical tests showed nothing. Then he started limping, he was vomiting, and he became pale and feverish in the afternoons. By this time, new tests revealed that my son had acute lymphoblastic leukemia.
The word leukemia comes from two Greek words that mean white blood. Leukemia is the general term for a blood cancer that begins when something goes wrong with the normal development of white blood cells. In acute lymphoblastic leukemia, or ALL, the most common type of childhood leukemia, the disease begins as immature white blood cells start to overwhelm the body's normal blood factory. It starts inside the bone marrow, where white blood cells, red blood cells, and blood platelets are made. White blood cells are designed to move into the bloodstream to fight infection. Red blood cells circulate oxygen in the body. And blood platelets act as internal band-aids, creating blood clots when the body is injured. With acute lymphoblastic leukemia, the white blood cells stop developing at an immature stage and are overproduced. These leukemic blast cells crowd out normal white cells, making children prone to infections. They also prevent the production of red blood cells, which makes children anemic and tired because there is less blood to carry oxygen around the body. And when blood platelets begin to diminish, children start to bleed and bruise more easily. Because this disease originates in the bone marrow, it is not always detectable by blood tests early on. But parents will notice something is wrong. Symptoms can include fever, frequent infections, mouth sores, weakness, fatigue, paleness, easy bruising, bleeding, or red pinpoint rashes, swollen lymph nodes, bone or joint pain, headaches, and in boys, a painless swelling of the testicles. Acute lymphoblastic leukemia is the most common leukemia in children and the most common cancer in children. Approximately 300 new cases are diagnosed every year in Canada. In the vast majority of cases, we do not yet understand why the disease develops, though it is an active area of research. This means that childhood leukemia is not caused by one thing that happened or did not happen to a child.
There you go. There you are.
Aside from blood tests to measure the number of white blood cells in the bloodstream, we rely on two other diagnostic tools. These are called a bone marrow aspirate and a lumbar puncture. They are used to extract bone marrow and spinal fluid samples. We extract bone marrow with a special needle. The marrow sample will reveal which type of white blood cell is causing the problem. Once we determine the diagnosis of acute lymphoblastic leukemia, or ALL, we look further at two types of lymphoblasts, or abnormal white blood cells. They are called T cells and B cells. T cells normally act like tattletale cells in the body. Their job is to identify viruses and bacteria and send out a call for help. Leukemia arising from these cells is called precursor T ALL. B cells are like bully cells that normally respond to the T cells' call to help fight disease in the body. Leukemia arising from these cells is called precursor B ALL. Precursor B ALL is the most common type of childhood leukemia we treat. A child's chemotherapy and drug treatment depends on which of these two white blood cells is malfunctioning and proliferating. We also look to see if these cells have migrated into spinal cord fluid, which also surrounds the brain. To extract spinal fluid, we perform a lumbar puncture. Again, we use a special needle for this procedure. If the leukemia is in the spinal fluid, we may use radiation in our therapy program. We sedate children for procedures like bone marrow aspirates and lumbar punctures.
You'll be awake before no time.
Parents always stay with their children until they fall asleep, and they are also in the recovery room to greet their children when they reawaken.
So once the diagnosis was confirmed, Jeremy was admitted to the hospital right away for chemotherapy and steroid treatment. He got very sick from the chemotherapy, but at the same time between courses, he actually started to seem like himself again. He started joking around with the nurses and with me, and it was like I got my son back, you know. We haven't been in for a year now. After a couple of weeks, our doctors discharged Jeremy and prescribed medicines for him to take at home. But he regularly needed to be readmitted to hospital for ongoing tests and chemotherapy, especially during the first 6 months of his treatment. One thing I noticed about the treatment was the hunger caused by the steroids. There were times when he would just devour whatever it was he was craving.
How long did it take you to make these flowers?
1 night.
1 night?
For every child with acute lymphoblastic leukemia, the first thing we do is to support their kidneys with IV fluids. This is because the diseased white blood cells release a lot of salts into the bloodstream, and a child's kidneys can become overwhelmed trying to clear out all of the potassium, phosphate, and uric acid from the body. And before we design treatment for the child, we weigh many factors: their age, the number of ALL cells circulating in the blood, whether those cells are T or B cells, and whether they have spread to the spinal fluid, which covers the brain and spinal cord. For the first couple of weeks of treatment, the child will stay in hospital. But once the bone marrow shows some response and the child is doing well, we will continue treatment on an outpatient basis. We work with a 5-phase plan to defeat the disease. First, there's induction therapy. It is generally a month-long fight to kill as many ALL cells as possible. During this month, we will work to get blood counts back to normal.
He's a crazy pants, but he's a sweetheart, a good kid.
No, I am not a sweetheart.
You're not? Are you a crazy pants, though?
Yes, I am a crazy pants.
There you go. We noticed that his arms were kind of sore when we would play with him. We asked him if he was hungry. He said no. We brought him into our family physician, and he thought he had the mumps. He had a fever.
So they did blood work. Just as we were going to bed that night, a pediatrician called and said, you have to take Sully to Children's. They're expecting him. The pathologist has confirmed he has leukemia.
Sully has pre-B cell acute lymphoblastic leukemia. It's the most common type of leukemia in children. We treat acute lymphoblastic leukemia with chemotherapy. For boys, it's about 3.5 years, with the first 6 to 9 months being very intense, and then the last 2.5 years with something called maintenance chemotherapy.
We just started maintenance today, which we've been doing frontline treatment for 9 months. We've been inpatient for probably close to 30+ days. But Sully is considered high risk because of CNS, which is disease in the spinal fluid at time of diagnosis.
Thanks to great research and clinical trials, we've come so far in the treatment of pediatric cancers, especially leukemia. 40 or 50 years ago, this would have essentially been fatal. We rely on funding to move this research forward and be able to bring it to our patients. The National Cancer Institute only budgets about 4% for pediatric cancer, and 14,000 children are diagnosed with cancer in the United States each year.
My boy got no choice. He just got sick, and there was nothing anybody could do about it.
When I had him, I wanted to protect him, and I feel like I let him down because when you're standing over the edge, looking at something that could take away your son, it's pretty scary. But, you know, he's doing great, and day after day, we just have to remind ourselves, base it on how he's feeling. And as you could tell today, he's doing amazing.
My hope's that in 20 years, if we were having the same conversation, that we wouldn't be having it. We won't stop until everybody has a prognosis of 100%.
Hopefully that him going through this, if this means one step closer to, not even a cure, but just a shorter treatment time. If we can get down to a year.
There are things you would overlook, like a bloody nose, but we had just turned the heat on. Her brother had a bloody nose too.
She had these awful stomach pains, and I felt helpless, and then they would subside. They were pretty intense. Little did we know that her liver and spleen were swelling. And I took her to see my doctor, and he's like, "Jimmy, I don't like these numbers. I think she has leukemia." And I said, "What?"
And it was this just unbelievable emotional roller coaster. Every piece of news you get that's not good feels like it could be the end. You have to start to trust in the doctors and the nurses that they're doing their jobs, that they know what they're doing, and that she is going to get better.
What I love about Lulu is that she's feisty, and she's sometimes a tornado, and she's just really funny. When Lulu got sick, I felt really scared, and I didn't know what was going to happen.
During the course of her treatment, I tried to explain to her the ups and downs, and how do you tell a 5-year-old the journey that cancer is going to bring you? It's very hard to describe. So she was very ill. She put her hand on my hand as if to stop me and say, "Mom, I know. Storm, rainbow, and she drew a little rainbow in the air with her finger. So she just understood intuitively what this journey meant at age 5 that I couldn't even explain to her.
She really showed me how strong, how powerful children are mentally and physically.
I'm going to ring the bell because it's the end of my treatment.
All right, everybody, this is the last dose of chemo. Ready to ring that bell? When your last chemo has come and gone, ring this bell to tell everyone. It's time to celebrate. Hip, hip, hooray. What a great feeling. What a great day.
We've been so blessed and so fortunate to get to know such a wonderful little girl and such a wonderful family. Honestly, they were amazing through the entire journey, all of them.
Inside the hollow area of the bones is a spongy core called bone marrow. It is here that stem cells are produced. Stem cells are immature cells that can develop into components of blood. Red blood cells, which carry oxygen to the body, white blood cells or lymphocytes, which fight infection, and platelets, which help blood to clot. Acute lymphocytic leukemia, ALL, is a cancer of the stem cells in the bone marrow that produce lymphocytes. The term acute means the cancer cells multiply rapidly, crowding out the normal cells in the blood and bone marrow. In addition, as the number of unhealthy lymphocytes in the blood and bone marrow increases, fewer red blood cells and platelets are produced. If the bone marrow is unable to produce enough healthy lymphocytes, the patient will be unable to fight infections. The leukemia cells can travel in the bloodstream or metastasize to other organs in the body where they begin to form additional tumors. Common symptoms of ALL include persistent fever, fatigue, bleeding, easy bruising, and swollen lymph nodes. Chemotherapy is the first line of treatment aimed at destroying the leukemia cells and allowing normal blood cells to grow. Radiation therapy, biologic therapy, and bone marrow transplantation may also be used if chemotherapy is unsuccessful. Acute lymphocytic leukemia is the most common cancer in young children. However, nearly 80% of all children with ALL can be cured.